Well, welcome back for a new cardiology countdown of 2011. We have three interesting studies, and beginning with the number 3 spot, we have a study of HDL function. Now, we've all known that higher good cholesterol, HDL, is associated with better outcomes, and we believe that relates to reverse cholesterol transport. Now, the level itself is one aspect, but the function of the HDL particles becomes very important. And so Dan Rader and his colleagues measured the efflux capacity of HDL and saw whether that could correlate with atherosclerosis. Now, we measured this in 203 healthy volunteers who had had carotid IMT and 440 patients with confirmed coronary disease and about 350 who did not. And they found an inverse correlation between the ability to efflux cholesterol by HDL and the degree of carotid intimal media thickness, again showing that this would be a measure of improved or better arterial function. They also saw a correlation between presence or absence of coronary disease. And so this becomes a new study documenting that the function of HDL appears to be very important and as important and independent of the actual level of HDL. At the number 2 spot, we have a study in JACC, just published, a randomized trial called AVRO that looked at an investigational drug for acute conversion of atrial fibrillation, vernaculant. This was a study of about 250 patients with new-onset atrial fibrillation and a comparison of intravenous vernaculant versus intravenous amiodarone for acute conversion. And they found a much higher rate of conversion with vernaculant, 52%, versus just 5% by 90 minutes with intravenous amiodarone. Now, this is in par with 2 other studies, the ACT 1 and 2 studies that looked at vernaculant that each had about a 50% conversion rate acutely, either in new onset or post-CABG AFib as compared with placebo, with rates of about 4% and 14% in those 2 groups. And so this looks like a very promising new agent where one could envision potentially new paradigms evolving with acute conversion happening in the emergency department and potentially outpatient management in selected patients. Obviously, this still is under review and not yet approved in the United States by the FDA, but one that's very promising in the field of atrial fibrillation. So this week's number 1 spot is a warning to all of us that says, couch potatoes beware. It looked at total screen time and found an increased risk of death and cardiovascular events in people who had more than 2 hours screen time per day. Now, this was an analysis of over 4,500 patients in the Scottish Health Study done in 2003 with patients followed for 4.5 years. And compared with those who had less than 2 hours a day of screen time, and that's either watching TV or DVDs, video games, or leisure computer time, so work didn't count, that those who had more than 2 hours had a 50% higher mortality and 125% higher risk of cardiovascular events. And so this comes at a good time when we're doing New Year's resolutions, and one where we may take this to heart and make sure to exercise more, which is my annual New Year's resolution. So with this week's Cardiology Countdown, I'm Chris Cannon.